And thank you for joining Protected the Vulnerable during COVID-19. It's our first in a series of presentations for Rotarians and Rotary Peace Fellows to share information and learn about the effects of the COVID-19 pandemic and share information with you on the many social justice, peace building, and healthcare issues that we are all working on. Today, our goal is to use this pandemic to create opportunities to generate new ideas, new partnerships, and above all, create action steps that we can take back to our clubs and communities to end violence against women and girls. You'll also hear us use the term sexual and gender-based violence. We're grateful to have so many of you on the call today, and we would like you to use the chat box to tell everyone your name and where you're joining us from. We'll be recording today's session so that those could not attend, we will send a link out to them and all of you who are participating today. The administrator is going to keep participants muted during the general session, so please use the chat box for comments and questions. My name is Kathy Doherty, and I will be your host today. I'm a Rotary Peace Fellow who completed the certificate program at Chulalongkorn University in Thailand in 2018. I'm currently in Chicago, but work as the head of the gender unit at Lamayan Hospital in Kenya. So years before COVID-19, the World Health Organization, the World Bank, and the Center for Disease Control all declared that violence against women is a global pandemic and a major global health issue that affects 1 in 3 women. Sexual and gender-based violence includes physical, sexual, emotional, and economic abuse, rape and killing of women and girls just because they are women and girls, female genital cutting, bride burning, child marriage. This is not an exhaustive list. USAID calls violence against women and girls a human rights violation, a public health challenge, and a barrier to women's civic, social, political, and economic participation. And to add to all of that, it also undermines the public health, economic stability, and peace and security of nations. You know, Rotarians recognize the importance of ending this violence through their focus on improving maternal and child health and creating more peaceful communities. So let's take a look at the current pandemic. Currently, there's been an increase in violence against women and girls because it's linked to the lockdown imposed by governments trying to respond to COVID-19. What we've seen is that women and children who live in domestic violence situations have no escape from their abuser during the quarantine. So activists and survivors across the world have reported an alarming rate of abuse. In many countries, shelters, services, hotlines for women are not seen as essential services, so they're really not operating. And even here in America, there are still less resources and services and less coordination because everything is really going to work on the pandemic. France, for example, has seen a 30% increase in reports. Argentina, a 25% increase. Singapore, 33%. However, increases have been reported from China to Germany to Canada to the US and the UK. So today, we're going to hear more about this from our presenters, after which they will answer questions. So please post your questions in the chat box. After questions, we're going to go into breakout sessions for our discussion and come back together to hear the ideas and actions we've generated. So first, we're going to call on Regina Matiru from Kenya. Regina?
Yes.
Hi, you're on.
Thank you. Hi, everyone. My name is Regina Mutiru from Kenya. A Rotary Peace Fellow alumni from University of Bradford in the year 2015-2016. I would like to share my screen, but Bill, it's not possible to do that?
Just one moment, Regina. I'm finding your name under...
Okay. Okay, so then I can just start as Bill is trying to get that on. So As our host Kathleen has just shared, I will share a bit about what is happening in Kenya in terms of COVID-19 and the way the epidemic is affecting women and girls, and approaches that have been taken, some that are working and others that are not working, and what my initiative that I started with other Peace Fellows called Hamani Women Network, which means Women Peace Network, is doing to help victims of SDBV violence cope with the situation. So currently in Kenya, we have around, let me read this from the screen, even if I don't share it, I should be able to access that. So we have around 320 confirmed cases with 89 recoveries and 14 fatalities. And today it's the 42nd day since the first case was reported in Kenya. And what personally I've experienced in Kenya is awesomeness from Kenyan people in terms of well-wishers coming together, organizing and sharing what they have with the communities. I have seen a lot of people packing food from their fridges and sharing with those who don't have. I've seen others coming together and contributing resources to support those who do not have food and sending it to their communities. Besides that, COVID-19 has come with a lot of breakdown of the way the systems have been operating, and we've seen a lot of effects on men due to the lockdown that has happened in Kenya. Currently, there's a lockdown that people cannot move between 7 p.m. and 5 a.m. in the morning in Kenya. And there's also a blockade in some counties where there's no movement at all, around 5 counties out of 42 counties in Kenya. So this has meant that majority of men are indoors, they're not getting out to do their daily routines of work. And this has brought a lot of depression because from our patriarchal society, we find that men feel they have to provide for their families. And now that they're not able to get out there and provide and bring food back home, then there's a lot of feeling of not sufficient, they're feeling depressed, they're feeling stressed. And this is in some cases resulting to gender-based violence in homes. So you find that some men are battering their wives, they become violent in the house, they start meting violence on the children. And that has resulted to the increase of cases that have been reported in the Kenyan Ministry of Gender and the courts. In our courts, we have seen an increase to 35% on sexual and gender-based violence. And the Ministry of Gender has also reported some increase. Currently, there are around 115 cases that have been reported in the month of April, and 9 of these cases are men. So gender-based violence is not only happening to women, but also to men in the house. And this has meant that some people will get out and report the cases to the police, but there are those who are not able to do that because of the curfew. Then you're not able to, because domestic violence mostly happens at night when people come from work, when we were working then. By now that people are in the house, mostly it happens at night. And during that time, people are not able to move from their houses. So some people will never report it because they're indoors and they're not able to get out. They avoid to be received by the police outside, and then the impact of getting out during curfew hours, it's just crazy in Kenya currently. And so they will just opt to not to report. But those who've been able to report then, they are meeting violence on the other end when they go to report some of these cases. And what we have experienced is that the mindset of the police in the police stations when women or men go to report these cases of gender-based violence is that a lot of attention is going to COVID-19. A lot of resources have been taken to COVID-19. So police have no time to receive complaints around gender-based violence, and they will put off and send off these victims and tell them to go and sort out their issues at home. So there's the desire to report, but where to report becomes a problem. Then there's also the issue of those who are not able to report because they are living with their violent partners in the house. And then there's also the issue of the curfew, they're not able to get out. So what we've seen and what we are asking our government is that they have allocated very little resources to social issues in the country. And when I talk about social issues, I'm basically referring to gender-based violence in terms of there's competing interest of the resources. So they want to focus more on COVID-19 and make sure that the health of the citizens is taken care of, which is good. But then they've forgotten these other sectors, like the social aspect of it. They've forgotten that gender-based violence, whether there's COVID-19 or no COVID-19, still continues. And during this time, the cases have gone higher, but there's no response to that. As much as the Ministry of Gender and the courts are reporting that there's increase in data in terms of those who are reporting, there's no action that has been taken towards that. Then even sometimes when an action is taken and women would want, not only women and men then would want to leave their homes and go to a shelter where they can be taken care of, then there are no such shelters in Kenya. There are no shelters by government. There are a few shelters by civil society, people who've gotten out there and opened their homes to host people who've gone through gender-based violence. But there are no shelters specifically by the Kenyan government. There are no resources that have been allocated to come up with shelters by the Kenyan government so that they can house those victims of gender-based violence. It is churches, it is people like myself who will come up and open my home to house people who have experienced violence from the other end. So then that becomes a challenge in terms of shelters. And just to conclude my short presentation, is that the government of Kenya has come up with a counseling and psychological care framework that they're encouraging people to access. And what we've experienced with our men in the past is that they shy away from accessing such places. And so for me, I'm seeing an opportunity for myself and my organization and just sharing it out there that it's an opportunity for us to think on how to support men, get out there and seek help. Because some of the men who have lost jobs and they're feeling the stress and the pressure of not being able to provide, how they are expressing this is through violence and maybe battering their wives and the children. How about coming through and coming up with an idea or a solution to encourage them to seek help? I don't know what that would be, but I would want to explore that more. I was sharing this with someone and they thought of a Zoom meeting for men only and just sort of a safe space for men to share. And finally, what I am doing as the Women Network together with my other partners is that we are doing our small way of helping communities to overcome this COVID-19 by sharing food. We are organizing, contributing among ourselves and buying food and sending it to the informal communities. We are also offering psychosocial support. We have some of our members who are experts and they are psychiatrists and they're able to help people through the phone and guide them. And finally, we are also sharing the toll-free numbers and connecting and linking people who need help with the help that is there. So from my end, that's what I have, and I'm grateful for this opportunity. Thank you.
Thank you, Regina. We now have Kanika from Bangladesh, who will share her perspective from that part of the world. Kanika, are you still on mute? Let's see. Kanika,
Yeah.
screen.
Hi.
Oh, there we go.
So, thank you very much, Kathy. My screen is showing on the screen.
Yes.
Can you see? Oh, wait, well, thank you very much. So I am Konika from Bangladesh, but currently I am working in Myanmar with the LWF. It's called Lutheran World Federation. I am basically working with Rohingyas IDPs in Myanmar, and I'm going to share that how COVID-19 is increasing gender-based violence for Rohingyas IDPs in Myanmar. So before going to share about their the current situation and how we are supporting to them, I just wanted to give a brief description about gender-based violence. We all are aware about that power imbalance and gender inequality is creating the gender-based violence. And if we see that what kind of violences are existing in these communities, most of the every kinds of violences are there: physical, psychosocial, emotional, sexual, economic, intimate partner violence, trafficking, forced marriage, early marriage. I mean, the situation is really, really very much vulnerable. And during COVID, the situation is more, increasing this kind of violences because of most of the men and the young boys. They do not have any movement to go from the camp to outside. That's why they are around in the camp, and then for that reason, the girls and then women, they are abusing by themselves, and also intimate partner violence are increasing day by day. And because of as Regina also mentioned that most of the men, they do not have any work, and they are now at home, and then their wife battery is also increasing, and at the same time sexual extortion and exploitation and abuses towards children are also increasing. And in addition, we also notice that as because nowadays most of the healthcare organization, they are very much concerned about the COVID-19 cases. So that is the reason also that women, vulnerable women or girls, they might not be getting more support from the health health departments for this kind of the violences. So as an NGO and also the UN, what we are doing, our priority actions are that, work closely with the partner organizations and also authorities, government authorities, to combat with this, the COVID-19 preparation, and also so that we can focus on that gender-based violence and mental health services. And we have also some of the organizations have their medical facilities like MSF, and some of other organizations, DRC, IRC, they have very good psychosocial support team. So we are trying to coordinate with this kind of partners so that if there is any kind of cases, immediately we can refer to them. And we are also maintaining protection monitoring activities. We have Kobo software, which is available in the community level. During this COVID-19, our staff, ground level staff, and also most of the staffs are working from home, so it's not possible to go in the field level to collect their information. But community people have the Kobo software, and in that software, if there is any kind of the issues, they can report immediately through that software, and that information is coming to us immediately. And we are also trying to ensure their right to health, including sexual and reproductive health, which is very much important currently, and without the all kind of discrimination, we are trying to follow that one. At the same time, in our community level, there are huge, the persons with specific needs like pregnant women, lactating mother, and disabled persons. So we are trying to giving them, specific assistance like cash and other services as well. And as I mentioned previous, provide case management and referral support through our others organizations who are also working on that, and meet the dignity needs of women and girls by providing dignity kits, and that is all is ongoing. and provide technical support to local leaders and sector and cluster government sectors professionals to prioritize protection in the overall response and to mitigate violence, exploitation, and abuse. Yeah, and as I mentioned that now that the staff are not, frequently moving to the community level, so that is why we are also changing our working modality. We are now trying to building capacity, community-based protection capacity through our community-based staff and CMC, Camp Management Committee. They are one kind of, the part of the government. So we are trying to giving them remote service, remote support so that they can take that leadership role to identify the gender-based violences, and then immediately they can inform us and they can get support. At the same time, we are also adopting various, the strategy to cope with increasing, restrict the movement of the people and social distancing measures, including increased use of, as I mentioned, that cash transfer servicing to move funds to camp for individual assistance and audio messaging. So this is very much important because in the community level, there are huge rumors about this COVID-19. So that is why, that rumor is also another issues to creating the violence for the women and girls and children. That is why we are trying to giving using the audio messages for awareness raising in the community level. Most challenging part is that, that Rohingyas people, they have their own dialogue and own language. So that is not very much common in Myanmar, because in Rakhine, they have the different languages. So there is a very, the severe language barriers. But we are getting support from the Bangladesh refugee camp, Rohingya refugee camp. What kind of messages they developed, we also send our messages to them so that we can get some support from them. So we are just connecting with Bangladesh so that we can collect the messages through their dialogue. Yeah, so that is my presentation. We all want to stop this gender-based violence. Thank you very much for giving me this opportunity to share my work here. Thank you.
Yeah. Thank you, Kanika. We'll have a chance later on to ask more questions about the Rohingya and internally displaced persons and again, the additional challenges that they face during this time. Now I'd like to ask another Rotary Peace Fellow, Elsa Marie de Silva in India, to share what they're experiencing there in her perspective on sexual and gender-based violence.
Thank you, Kathy. Good evening from Mumbai, and I hope all of you and your loved ones are safe and healthy. So we have been socially distancing since middle of March, and we had a national lockdown announced on the 24th of March at 8 p.m. with 4 hours notice, effective midnight. So as you can imagine, for a country the size of India, when nobody saw it coming and there was no proper communication, it resulted into utter chaos. Of course, if you're privileged and you have access to resources, it's a minor inconvenience to move to working from home. But for a large part of my country folk, I don't know if you've seen images of people walking to their hometowns, which are more than hundreds of kilometers away because there's no public transportation available. And they cannot stay in the cities because, they are not being paid. They may have lost access to their homes, and therefore, they just want to return home because many of them are also seasonal laborers. And this is the time of the harvest season, so which is when they just go home. So given those complications, part of our work has been feeding, and Rotary in Bombay has been very helpful in that. They are also part of this coalition where we are feeding now on a daily basis 70,000 people per day, and I'm volunteering in that food distribution setup. Apart from that, my organization, Red Dot Foundation, works on sexual violence prevention, sexual and gender-based violence prevention. We focus thus far on public spaces, trying to make it safe. So any violence that was in a public space, in public transportation, we've attended to that, and largely through a crowd map. A crowd map is where we crowdsource anonymous stories of people's personal experiences. These are plotted on a map so you can visually see it. And this allows us to analyze location-based patterns and trends so that you can, you can design your interventions that work at that local level based on the context in which it's happening. So for example, most of us think of sexual violence and gender-based violence as a particular form of violence, but there are many different kinds. And I think one of the presenters in her, Kanika has already shown in her slide that it can take many forms. But even in that, there are many sub-forms. And if you don't have data, which is the case because there's a silence around due to the socio-cultural barriers that prevent someone from reporting, then there is, it basically makes the issue invisible if you don't have the data, if people don't report. Also, what happens is it creates an insecure culture because the onus is then on the victim to prove her innocence, whilst people around, larger society, bystanders, turn the other way and don't intervene necessarily when it's happening. Either again because they don't want to get involved, or they may not recognize what is happening as a form of sexual violence. And of course, the authorities like the police, the justice system don't really, step in to do their bit. And there's also low trust levels between community or the person experiencing this violence and, the official institution. And in all of this, the perpetrator just gets bolder over a period of time. Now, in COVID-19, in this particular scenario, where in my country and my city, it's a complete lockdown. So here we don't have crime happening in a public space because there's nobody there, there's no public transportation running. But what is happening is that there is a spike, like you've heard Kathy mention in the beginning, that there is a spike in domestic violence all over the world, including in my country. But now take, for example, you cannot leave your home. It's a really strict lockdown. You have to have a pass to go out. We don't have very large homes in India for most of the population. So obviously you're confined in a space with the perpetrator, with your abuser. You may also not have availability of a device like a phone or access to the internet just because that person may be standing there or may have restricted your device. And in many cases, a woman doesn't own a mobile phone. Hard to believe, but yes. In India, what we found is that mobile penetration is high, but not with women or for women. So in such a scenario, what can we do? So obviously we've extended the reporting on our crowd map to include domestic violence. This will be anonymous reporting. And in any case, our reporting is what happened to you, where it happened, date and time, and the kind of abuse. So we don't ask them for their name, email, or the perpetrator's name. And so there's no naming and shaming. Here in this particular domestic violence, we will not even look at the address. We will just mark it as the city, just to protect the identity of the person. The second thing that we are doing is we've partnered with a coalition of NGOs and the police for helplines. So at this point, the only people who can reach a survivor if she needs to be physically rescued is the police. But given that there's low trust levels, we are asking that helplines be manned by civil society organizations and then mapped to various resources, including the police, but counseling and legal help being some of those. The third aspect that we are working on is Safe Circle. Pretty much like this, an online space that people can sign up to and, just have a chat with someone, learn from peers, create community of support. And that is launching next week. So we are thinking of creative ways to get these women or whoever is in that situation the help that they need, and given the current context. In the process, through the reporting, we hope to understand domestic violence better. Again, you know, there are many forms of domestic violence, so helping you know, shine a light on what can be done through, you know, creative ways to reduce it. So for example, I'm sure there's a very tiny percentage that needs physical rescue, immediate rescue, but a lot of it can be worked on through community interventions, through larger influencers in that person's life. So, but unless we have that data, which we've learned through our past work in Safe City, we won't be able to, you know, figure out what are the different kinds of interventions required for that person, given also that in the Indian context, many women are not financially independent to leave their home, and we don't have the shelter homes or the other support mechanisms that other developed countries may have for them. So in such a scenario, we have to do the best for that person given the context. And yeah, so unfortunately, we had to have this pandemic, the COVID-19, expose the other kind of pandemic, gender-based and sexual violence that has been happening for a long time. And I do believe that Rotary has the power to help shift attitudes and also put resources towards ending this form of violence, just like y'all did with polio. So I would urge you to, you know, help us work on this issue and make sure that the next generation doesn't really have to suffer. Thank you.
Yeah, Elsa, that's a great point, because it's clear that Rotarians are folks of action, and when they take action, they've been able to really change huge pandemics themselves, right, around the world. So in our breakout session, we're going to talk more about what kinds of action we can take based on what you're hearing today. And so I want to move to our final presenter, who is also a Rotary Peace Fellow, Will McInerney. I know, sorry, Will, I slaughtered your last name there. And he's based in the UK, and he's going to share with us sort of his perspective, especially about boys and men and the impact they can have in ending gender-based violence.
Wonderful. Thanks so much, Kathy, and thanks to my three colleagues who went before and shared their really important and heroic work that they're doing around the world. So I thank you all for the work that you do. And it's wonderful to see so many faces here today digitally. I'm gonna go ahead and share my screen and see if I can manage to work this. Let me know. I think that is working. So yeah, wonderful. It's great to be here with y'all. My name is Will. I'm a Rotary Peace Fellow, formerly at the University of Bradford. I'm currently a doctoral student at the University of Cambridge, where I teach men's violence prevention education programs around the UK. And I also research those same sorts of programs and try to better understand how we can engage boys and men in challenging and important conversations about gender equality. How can we ultimately reduce gender violence around the world by increasing the number of people that are working on these efforts? And so kind of building on some of my colleagues that you all have just heard and the work that they're doing around the world, I've also noticed that, you know, men are coming up in the conversation in terms of thinking specifically, what can we do to address men's concerns in a pandemic like this? What can we do to prevent some of men's violence, and how can we bring them into the fold? I think now more than ever, we need to change a trend that we've seen for far too long, which is that women and non-gender conforming folks have historically and courageously led the efforts to end gender and sexual based violence. And unfortunately, many men have been absent from those efforts. And so my work as an educator and as a researcher is to try to challenge that trend and to bring more men into this conversation. And I think as we see domestic violence rise around the world in this pandemic, now more than ever, we need to increase the number of people that are working on it. And so we all know the statistics. We've heard them from Kathy. We've heard them from the experiences of our practitioners on the ground. Domestic violence, gender violence is an acute and important, severe issue affecting lots of women and girls around the world, as well as affecting boys and men, as has been noticed. And it's traditionally framed as a women's issue, a quote unquote women's issue. And that's for good reason, because as I mentioned, women and gender nonconforming folks have been leading this effort for centuries, and men have been absent. That's why we often frame it as a women's issue. Also, because women are disproportionately affected. So it's vital that we center and support women and girls, that we put our attention and our focus and our resources on supporting them, particularly again in moments of crisis like this. But I would argue that simultaneously, we also need to figure out how can we engage men in gender violence prevention? How can we simultaneously increase the number of folks that are working on this issue? So in addition to the moral imperative of men should engage because it's an urgent problem and it's the right thing to do, I want to lay out 3 reasons that are based on my work as someone who works with boys and men on these issues and what the research tells us about those. And so we should engage men and boys first and foremost because of the perpetration patterns. Most gender violence, most of the violence that we're talking about on this call today is committed by men. Men certainly can also be the victims of this violence, and women and gender nonconforming folks can absolutely commit violence. But the research consistently shows us that the vast majority of gender violence is committed by men. So in order to prevent this men's violence, we need to engage men directly, and we need to examine masculinities. And the second point there around examining masculinities is vital because the research also tells us that gender violence is not a biological inevitability, but that in fact, most of the drivers and the causes that we understand about gender violence are social in nature, meaning that in a lot of ways that they are rooted in gender norms. So the second key reason why we should engage men in these conversations is because there are some dominant ideas about masculinity that promote sexist and violent supportive attitudes and behaviors, and that these gender norms underpin a lot of gender violence. And we see this around the world. And so we need to engage men because men's gender violence is a social problem that requires social and collective solutions. So men disproportionately commit the violence, and the ideas around some forms of masculinity underpin it. By no means all forms of masculinity, because that's the key to the third point, is we should engage men because there are very clear and tangible peaceful possibilities. Men are not predestined to be violent. We know that because we know lots of men in our lives who are not. Men can play a positive and a strategic role in preventing gender violence. And there's a growing movement of men working with folks of all genders around the world, from South Africa to Brazil to the UK, to global alliances that are working on every continent, trying to challenge gender violence by bringing men into the conversation, to work with women's leadership, to work by continuing to support the survivors, and to challenging the perpetrators, and realizing that there is a role for all of us to play in this conversation. And this is the kind of work that I do as an educator and as a researcher, is working in this peaceful possibility areas, is how can we increase the number of folks that are working on this issue. Which brings me to kind of the summary here, is we need a gender inclusive alliance to prevent gender violence. This is true in every day of the year, and it's especially true in a moment like coronavirus, where we see spikes of domestic violence around the world. Men should support and be involved because first and foremost, there's a moral imperative. It's an urgent problem, and it's the right thing to do. But beyond that, because that doesn't appeal to everyone, is we need to keep arguing that it's a men's issue too. It's a men's issue because we need to prevent perpetration, which is primarily committed by men. It's a men's issue because we need to transform problematic gender norms, which are often rooted in some ideas of masculinity. And we need to promote positive alternatives. Positive, proactive, and peaceful masculinities are real. They are practiced in our communities around the world. And we need to continue to strengthen and support those. Which brings me to like a very short, which I'm sure we'll continue later, but what can Rotary and you do in these moments? And first and foremost, we can all continue to learn more. We can encourage the boys and the men in our lives to read about this. In the post-Me Too world, there are a plethora of free access resources available in languages around the world and distributed by amazing organizations that continue to do this work. So we can all try to challenge ourselves to learn more, particularly boys and men who traditionally haven't been involved. Once we learn more, we can use that knowledge to raise awareness. Boys and men are in a strategic position to influence other boys and men. And so we can use this opportunity to encourage them to challenge their peers, to challenge the men in their families and the men that they work with to continue to learn more as well. And we can challenge ourselves to all support the local and the global organizations like the three that my colleagues have talked about. There is an organization in your community around the world that does this kind of work. Now more than ever is an incredible time to try to support them tangibly in ways that we can. And last but not least, to remember that it starts with you, that all boys and men need to challenge themselves to not use violence and to practice these things that they believe in, they hold true. And in closing, and before we go on to the Q&A, I just want to note that there's a lot of great resources that have been released in the past month around thinking about the intersections of masculinity violence and coronavirus. There's a great article in The Conversation that I've shared a snapshot here from two of my European colleagues, Stephen and Sandy. And amongst many things, they talk about some of the things that you've heard from my colleagues here, which is thinking about how can boys and men address the spikes in domestic violence that we see? How can we address the inequalities that we see in home life? All too often, women do more childcare, house labor, and emotional labor. How can men use this moment, this acute crisis where we're stuck in the home, many of us, to challenge those imbalances? And how can we think critically about everyone's health and wellness, but particularly think about how it impacts boys and men? Boys and men disproportionately live less healthy and less well lives, in part because of some of those gender norms that I talked about that also influence violence. Studies consistently show that men wash their hands less than other folks of genders, that men go to the doctor less. So it's probably not surprising that in many geographies around the world, boys and men are disproportionately contracting and dying from coronavirus. And so thinking about what ways do social norms about gender impact domestic violence, equality in the home, as well as health and wellness for everyone, and particularly boys and men in this moment. And on that, I will pass it back to Kathy.
Great. Thanks a lot, Will. One of the first questions out of the box was asking about, what about men? What about boys and men? And how does, you recognized that, yes, gender-based violence does impact them in terms of physically, and that they can be victims of that, but that disproportionately women and girls are affected. And so I think going back to the introduction, it is clear that this particular gender-based violence impacts communities, it impacts nations, it undermines the work that we're all trying to do together. It's a human rights violation. So thank you to the presenters for the information that you've shared with us today. I'm going to reach into the chat box here and bring out some questions. There has been a number of questions, I think, about communication overall, right? We've talked about hotlines, we've talked about apps, we've talked about a variety of different ways that folks can reach out to get some help. But quite frankly, there was a question from someone in Kenya that certainly asking about, are there apps that work better than Zoom since the internet breaks down and the internet cafes are closed? And so I think communication in general, and Elsa was talking about if women don't have access to a phone, how are they reaching out? What are some other ways that folks can reach out?
Oh, I did respond to her separately, but I'll as well share with everyone that as she had indicated that WhatsApp works better, and Facebook Live sometimes also works better than Zoom. But again, most women in the informal settlements will lack mobile phones and such other accessories that can be used to communicate to them. But we have social workers, we have people who are working in those communities that know so-and-so lives in this house. These are the needs of this family. And so those are the kind of people we work with in my case, so that can reach the needy people in the community, despite them having mobile phones or not. there's a way you reach them through social workers. We know them even through the government structures that are there. Those are all the other opportunities that can be used, platforms that can be used to reach the needy. But through also volunteers, community volunteers, you can be able to identify the needy and reach to them.
Okay.
Kathy, can I add to that?
Yes, absolutely.
So when I say we crowd map, it doesn't mean that somebody has to, access the map only through the phone. For example, we worked with a Kenyan partner in Kibera, Jane Anyango from Polycom Development, and what she had was talking boxes that she had placed in schools and other spots. And what we did was we digitized the data for her and managed to cluster them so that we could look at it as patterns and trends. And when she was looking at it, she was looking at it as individual stories, whereas we were looking at as patterns and trends in this community. And that's how she was able to then advance her work and scale it up now to 45 schools with UNFPA across Kibera. So, there are spaces in our cities where Google Maps doesn't even work, all these informal settlements, even in Bombay. So people, when they put a location, they put near the pink school, the big building, the yellow mosque or whatever. So, but if you are able to digitize it and analyze it and cluster them, that value to the community can really, give them insights, and they bring the local context to that data set. That is what that's our strength, and that's what we do. Somebody asked about technology. So we have many different ways to report paper forms. We have a missed call. So we have an illiteracy issue. We have a language issue. So here a person can give us a call. It gets disconnected. We call them back, so they don't even have to pay for it. So if you want, you can think of creative ways, so technology should not be a barrier. The idea is, are you getting those stories? Because our official statistics do not reflect the true nature and size of the problem. Mm-hmm. That's my point.
Okay. And I think somebody also asked Elsa about the best crowd mapping tools, and are some of those free?
Yes, so we use a Kenyan tool called Ushahidi. Ushahidi was launched in 2007, 2008, when there was the political violence after an election. And since then, it's been used all over the world by different groups. There's a free version. There's also a higher paid version because they are a nonprofit too. But we've used it for free from the time we started. It was so easy to set up. And I would encourage you to look at that. And people have used it to map different issues.
Okay. So one of the other questions that folks had asked was sort of around the main outreach challenges, especially if people can't go out face to face. And so thoughts, we've talked about challenges with the phone, challenges in terms of internet, and I don't know, I know community health workers exist in a variety of different communities. I don't know right now if you're finding that even those folks aren't able to go out and check in on communities. But talk a little bit more about, if people can't go out face to face, how are victims and survivors able to get support or even work on a safety plan for themselves and their children?
So I'm going to take that, and then maybe somebody else can also add on. So really, I think that's where you and I come in as neighbors, as family members. If you hear screaming and shouting, let's take a moment to understand what's going on and maybe, interrupt. Sometimes it's interrupting the violence. And there's an NGO in India called Breakthrough. They have a very simple campaign called Ring the Bell. So you ring the bell and it just interrupts the violence. Those few seconds helps to calm the person down, or it also lets the person know, hey, others are watching, others are listening. So really the bystander intervention campaign is so critical at this point because, in known perpetrator violence, knowing what are the different forms of violence, even for child sex abuse for that matter, if there are lots of resources out there, you can educate yourself, you can figure out how to be a better bystander. And then as an institution, if you own an organization, and put in policies and resources that can help your employees, as well as make sure that your organization climate is safe and inclusive.
I would also add that people are moving around. At least in my case, Kenya, it's not a lockdown, it's a curfew. So people are able to move around so long as they keep the distance. And so what is happening with a lot of social workers and people like ourselves, we are accessing the informal communities and sharing the foods that we are packing and taking to them. And like 2 days ago, there's this particular group that found a family of 4 that was sleeping on the floor. They did not have mattress. They did have nothing in that house. They literally had nothing. So besides giving them food, they gave them food, yes, because it was not cooked. It was just packed maize flour and other items. They put it aside. They went out. They looked for a mattress. They looked for a bed. They looked for cooking pots and everything else that that family needed. And so, as Elsa is talking about, it's just personal initiatives, taking the initiatives as a person and just getting out there to understand what is happening to my neighbor, what is happening to this other neighbor. I was sharing with a friend that 2 days ago, again, I had some screams in my neighborhood where I live. And I live in an estate where people are not very free to converse with one another, sort of individualistic estate. And I shared the free toll number on the WhatsApp, on the community, on the apartment WhatsApp. I don't know whether they used it, but just taking that little step to share, you never know how far it will go in helping another person.
No, exactly. I mean, providing resources there, and when it's safe and they choose to use them, then they can use them. Those are great examples of that. I think here in my own neighborhood, people have sort of developed block captains. And so there's people that the neighbors on each other's blocks are checking in with each other in all kinds of ways, to see how they're doing, what do they need, can they help them in some way. And so they're organized sort of block by block. So it's a system that was set up so people are expected, they know that others are going to be checking in on them and seeing how they're doing. Kanika, I wanted to reach out to you as well. I think we had talked that social media was big in Miramar, and I don't know how or if that modality is being used. Those modalities are being used there to send out particular kinds of messages, or if that's even helpful at this point in time.
Yeah, actually, through the media, they are very much aware about the COVID-19 issues, but not that much, focusing on gender-based violence. But COVID-19, how to take the measure, people need to wash their hands using this, mask. So these are very much, very much put, but about the gender-based violence, not that much still now.
Okay. Yeah. Okay. Is that something sanctioned by the government, or is that just that people haven't felt comfortable?
I think that this is a cultural barrier, like, reporting about gender-based violence is not that much focused in such kind of countries. So we are really struggling a lot because people don't want to share that, they are in a, if someone has intimate partner violence, they
Right.
have that experience, but they are not come out with this kind of, the situation. So we have to mention, the very strict confidentiality on that issues. And we have to confirm to that, the vulnerable person, that we are not sharing with anyone about that issue. So yeah, but it's not that much open like Kenya and India and what we are listening from our friend. But in Myanmar, and even though in Bangladesh also, not that much open about that issue.
Yeah. Well, certainly we have gotten some ideas around, I think, some of the more difficult questions that folks have asked. And what we want to do right now then is move into, after listening to all of this from our presenters, listening to the answers to the questions and the dynamics around this particular issue, sexual and gender-based violence during the time of COVID-19, we want to hear everybody else's thoughts about and generate ideas that can be taken back to your clubs and to your communities. So we're now going to assign breakout rooms with a group number, and Rotary Peace Fellow will facilitate the discussion. In the chat box on the right side, Bill has listed, there's questions there that we want to reflect on once we get into our own breakout session and think about how we want to address some of the things that we've listened to. So facilitators, please remember to copy and paste the questions, the discussion questions, into your room's chat box. So Bill, I'll let you do your magic to organize us and pop us up in our groups where we'll begin to talk more.
Okay, everybody's placed in a breakout session, and that will start now.